Welcome to Infinity Whole Health Care, featuring the Revealing Wholeness podcast with your podcast host, Dr. Troy Munson.
I'm Dr. Troy Munson. Today we're going to talk about some interesting heart things. I know we've done heart in the past, but I've had some questions about aneurysms. Bill, you know people with aneurysms?
Yes, I do. Well, it's kind of an interesting topic. One gentleman just had open heart surgery, and it's hard for me to believe that within 7 days he's out walking his dog.
Yes.
Amazing.
You know, they want people out of the hospital rather quickly when it comes to heart stuff. In fact, I remember reading, at least a decade ago, a study where they took 25 people and they talked to them or told them everything they could think of that had to do with the heart. How it worked, what was happening, what was going to happen in the surgery, how did they heal, everything they could think of. And they took another 25 people and left them completely in the dark. And they watched the people that had all the information heal in half the time. They're like, how is that possible? And so part of it is placebo. They take people now in Europe where they tell them, this pill will do nothing for you. It's a placebo. It has no nutritional effect, no chemical effect whatsoever. And the people will still take it. And
Why?
They get better.
Oh, and they get better, but yet it has no effect on the body.
It has no effect.
Oh, good.
And so now they've actually shown that if they have somebody, let's say, has shoulder pain, they'll make a cut on their skin, sew it back up, and then see how they do. They don't do a surgery. They do nothing. And people get better. And so they call it a sham surgery because the mind is really potent healing. And if you think something's happening, it is.
Very interesting.
So that's the wild thing. So we do want people to have a certain amount of information when they're healing because that becomes important. So one of the reasons for our, my podcast is that you would have better information and ultimately have more trust and more understanding of what this amazing designed body can do and how it does maintain health really on its own with a whole, wholly just a little bit of effort. And so as we go through the process, when I start adding nutrients to people for something, they're amazed that within a very short period of time that they really do feel quite a bit better and that they're coming around. Now I had a client today said, hey, I got an abdominal aorta and it's getting there. And they won't necessarily do a surgery until it gets to a certain point. They're not going to go in and cut on it and divert blood and try to heal up an aneurysm if they don't have to. And so I think it's weird that, hey, we see an aneurysm on your x-ray, but we're not going to do anything until it gets really bad. I'm like, what's really bad? Well, if, let's say, an aorta is 2.5 centimeters, maybe 3 centimeters abdominally, and they're going to wait until it's 5.5 centimeters. I'm like, it has to be big. I remember seeing one in a client thinking, wow, this is really awful. And he comes back like 2 days later and says, hey, they said it's not bad enough to do surgery. I'm like, what? I thought any aneurysm was not a good scenario for anybody, but apparently they'll continue to wait. So if we look at an aneurysm in a blood vessel, typically an artery, well, only an artery, we see that we have a nice thick muscle wall in an artery, and that muscle wall begins to break down. As muscle begins to tear down, we'd also look at it more from even an athletic point of view, like what makes a muscle tear down? Well, yes, overuse, but non-repair. And so things that really affect repair is chronic use of NSAIDs or non-steroidal anti-inflammatories. So if you go to your cabinet and you have something like a Tylenol or some form of aspirin, you may find that it's actually an NSAID. So NSAID, non-steroidal anti-inflammatory drug, is what that stands for. And if we inhibit the inflammatory process, every time those blood vessels kind of give and relax and sometimes even do contract, they're tearing down their fibers, just like a muscle, just like the heart, just like a lot of things that we do in our life. We're creating microinflammation. That microinflammation, though, is important. We need that inflammatory response to bring nutrients into the area, white blood cells to eat up debris, all that to happen. And if we inhibit that inflammatory response, we now actually slow healing down by 3 times or more. So let's say if I am going to, I'm a professional athlete and I tear up a quad, they are not going to give me anti-inflammatories. They do not do that to professional athletes anymore. But yet, what do we find on the store shelf?
Well, that same type of chemical that's sold over the counter for everything that you can think of.
Yep, and for over 30 years, we've known that if we take an anti-inflammatory drug, we're going to slow down healing by at least 3 times. We're going to take 3 times longer to heal for anything. And so we have these young athletes that don't know this kind of stuff, and they'll go ahead and take, I guess Tylenol's a big one. I'm not sure if Advil is. Advil might be a straight pain reliever. There's a couple others out there that are totally NSAIDs. And they've actually outlawed some NSAIDs because they're so good that people start having heart attacks. Every time our heart beats, we have microinflammation in the heart. And it's supposed to repair and be stronger. That's how it does. So, aneurysm situation, we've got a muscle wall being torn down. So we've got protein issues. Well, how do we have protein issues if we're eating protein as Americans all the time? Well, part of it's a digestive issue. We don't have the digestive potency to break down that protein. How would I know if somebody wasn't doing well at digesting protein? They would have foul-smelling gas, point blank. I'll tell clients that if you fart, you should not have a lot of smell. Said, okay, so you eat a lot of vegetables and it kind of has a fermented vegetable kind of smell. Fine. But if you're smelling putrefaction, like you are not digesting protein well, you got issues. And we need to fix that first and foremost before we go any further. Other things that affect muscle integrity are going to be calcium, and it's going to be copper. And copper, as we've talked about in other shows, is the core of the vitamin C complex. So how much vitamin C are you putting into the system? How are you doing there? And then, so we've got calcium, protein, copper or vitamin C, and manganese. Manganese is a biggie for many people. If you're sitting out there thinking, well, how would I know if I have a manganese deficiency? My first question to anybody who's I'm wondering about why they're not repairing and why they're not, their joints aren't better, they're spraining their ankles, all kinds of things. I'll ask them if they have flat feet. Flat feet is a hallmark for manganese. Now, in my particular area, I've mentioned this in other shows, we have a lot of wells because we're kind of out in the country here. And in most of the wells around here, there's metallic manganese. And I have patients all the time say, well, isn't that like magnesium? I said, well, they might both start with an M, but they are absolutely different. Magnesium is completely different than manganese. Manganese is important in ligamentous integrity and strength. So you feel like your joints are kind of too loose. You might go to the chiropractor and you feel like, I just went, now I feel like I have to go again. You might be classically a manganese deficiency. And so those are important. If you tend to sprain ankles more frequently or roll your ankles or your knees are weak, this would be a concern for you. And so if we're doing these 4 things, what we call the big 4 for the muscle and joint integrity, which is going to be a lot of what makes up a blood vessel like an aorta, and we have an aneurysm in there, we want to start doing those things and start allowing the system to start healing. And again, removing any inflammatory products from the diet as we possibly can. So sugar, carbs, getting the liver to work right, things that we've mentioned over and over in other podcasts are absolutely important. Other things that are really important, I have athletes that get injured and they tend to have a lot of weakness or they don't heal real well. Or let's say I've got a female athlete and she's just had a pregnancy and she feels very tired and she may not be sleeping well anyways, but she just doesn't feel like she's healing great. She'll be more of a cataplex E scenario or a vitamin E issue problem. So vitamin C and vitamin E are biggies for the athletes because that's kind of our bread and butter, so to speak. And very few athletes get a lot of vitamin E. They might take a pill, which is a synthetic preservative like D-alpha tocopherol. That's just a preservative portion of the vitamin E complex. And a lot of athletes will take ascorbic acid. Hey, I take 500 milligrams of vitamin C a day. I said, if you're taking 500 milligrams of vitamin C and you know you're taking 500 milligrams of vitamin C, you're taking a synthetic because you can't fit in a tiny pill 500 milligrams of ascorbic acid and have it naturally derived. And so the pill, if it had 500 milligrams of ascorbic acid naturally derived, would be the size of a ping pong ball because ascorbic acid is just the preservative portion of the vitamin C complex. The entire complex is more than 95% of what really vitamin C is. So be cautious out there. If you think you're taking vitamin C and vitamin E, and you're getting it from a pill and it's not real big, you're probably taking a synthetic. Unless it's brown and you read in the ingredients that it has food in it, that you realize you're taking food. So when it comes to the heart, we want food. I just had another good friend of mine have AFib, which is typically a cataplex B or a vitamin B issue. And we don't just want to run to the store and take a B supplement that's got 5 B vitamins somebody synthesized in a lab and lacks all the other phytonutrients, all the minerals, all the other things that make that B work correctly in nature. If we locate B vitamins in nature, it has so many other things with it. Food and Drug Administration, they stopped, all these scientists stopped labeling B vitamins after something like B84 because they realized a lot of these things were maybe not vital amines to get a classification of a vitamin, but some of them we made in our bodies. Some of them are just attendants with the B complex, but that were very important in helping them work correctly. And so when we give things to people, we want it to be in a food source so that it actually goes in and supplies the nutrients and the loss of minerals, and so we can correct those deficiencies, and we have a system that heals. We have muscle tissue that heals. We have organ systems that heal. We have blood vessels that heal. And now they do their job much better. So if you're faced with something like an aneurysm or something like that, then there's things that we want to do that really stimulate those areas to begin to really target those tissues to heal. And that can be done. It just takes doing it. And if you're thinking about, taking a drug, if the food you're eating right now got you to the condition that you have now, how is a drug supposed to take the place of real nutrients and actually add value to the human body and not damage it even more? All it's going to do is placate the problem that you have right now until it's so bad that nobody can really rescue you. And so really think twice about doing drugs. Not that I'm against drugs, but they have a certain application for a very limited amount of time. You should be doing something different in order to make sure that the drug is no longer necessary. So if we've got a problem, we want to use a good tool. Drugs may have to be our tool for now, but they shouldn't be long term. We should use a different tool, one that is supplying nutrients and doing things better.
This information is for educational purposes only, and does not constitute medical advice, nor establish any kind of patient-client relationship, is not a substitute for any type of professional advice. Always consult a professional in your area for your particular medical needs.